The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.
Tonight, have we all moved on from the COVID-19 pandemic too soon? Then, a discussion with guests from this summer's Association of Municipalities of Ontario conference on the challenge of funding municipal infrastructure. That's next on the agenda. It was more than 4 years ago when the World Health Organization declared COVID-19 a pandemic and the world shut down. Now, things have largely returned to the way they were, but the virus still remains. How dangerous is COVID-19 today? And have people forgotten that the disease still poses health risks, as some are still feeling the effects of poor mental health? Let's ask Dr. Isaac Bogosh, infectious diseases specialist at Toronto General Hospital. Don Bowdish, Executive Director at the Firestone Institute for Boy, that's harder to say than I thought. Let me try that again. Don Bowdish, Executive Director at the Firestone Institute for Respiratory Health and Professor of Medicine at McMaster University. And Quam McKenzie, CEO of the Wellesley Institute and Director of Health Equity at CAMH, the Center for Addiction and Mental Health. And we are delighted to welcome you three here to TVO. I have to point this out off the top. You've been here before, but only on satellite. So welcome here for the first time. You've been here a million times, although never here. You've been on this show a lot.
Yeah.
But this is your first time you've been here.
It's lovely to be here.
Well, let's shake hands. This is the first time we've done it. Okay. And Quam, of course, was practically my co-host during COVID. He was here so often. Anyways, let's start by looking at the latest numbers for COVID-19 in Ontario. This is from Public Health Ontario. The period examined August 25th to September 21st of this year. COVID-19 cases in Ontario. Positivity, 18%. Outbreaks, 420. Hospitalizations, yes, people are still being hospitalized for COVID, 764. And deaths, 49. People are still dying of COVID. Isaac Bogosh, start us off here. Should we be concerned about those numbers?
Forgotten by many, but not gone. COVID is transmitted year-round. There's parts of the year where we see more COVID. For example, fall and winter, but it did not go away in the summer, and it will not go away. People are still getting sick with this infection. We know what the risk factors are for severe infection, like hospitalization and death, and the virus is continuing to do exactly what we would expect it to do. It is making older people and people at risk for severe infections, like those with underlying medical comorbidities, ill. They're still coming into hospital. Sadly, they're still succumbing to this illness. We do have tools to help reduce the risk of infection. Perhaps we're not using those tools as well as we could be. Let me rephrase that. We are not using those tools as well as we could be, and we have a duty to do so to protect the population of Ontario, the population of Canada, and from an equity standpoint, of course, the population of the world.
Don Bowdish, we are hearing that disproportionately older people are still suffering from COVID. How are they getting it now?
Same way any of us are getting it. Ironically, we think of older people as being the most likely to get hospitalized, but actually they're not the most likely to get infected. It's actually young working age people who are the most likely to get infected. So one of the reasons older adults get infected is socializing with friends and family, just as we all do. And so I think that's an important point for families to remember. I always say vaccination is a family affair because you do it not just for your own personal health, but you do it to protect the older adults and the vulnerable around you. And I think that's a message that families can take into the holiday season.
What are vaccination rates looking like nowadays compared to when we were in the thick of it?
Well, finding a vaccine is pretty difficult, actually. Though we've got COVID being a all year round disease, we don't have access to vaccinations all year round. So we're still waiting for the latest version to come. So vaccination rates have decreased. People didn't get into the habit of having COVID vaccinations like they have others. And there's not the same push that, say, for instance, there is for seasonal flu. And so vaccination rates are low.
I want to go off the page for a second here and just call an audible, because when you three showed up today, you had a mask on. You had a mask on, Quam. Isaac, you did not. And I want to have a little bit of discussion here about why you made those decisions. You want to start us off?
No. I'd love to hear what they have to say first.
Okay, fair enough. Dawn, why did you have a mask on?
For me, there's sort of a mix about my duty to the people I study and care for. So I study vulnerable people and older adults in long-term care, and it behooves me as a young person to prevent the spread of infection to the vulnerable people around me. But I'm also concerned about my own health. I am in the prime group for getting long COVID. That's 40 to 60-year-old women. And as well, even if it wasn't long COVID, having a serious respiratory infection does contribute to long-term health issues. So I think of it as easy, it costs me nothing, it's an investment in my health. And lastly, I did not want to get sick and infect you because you need to be doing the great work that you do. So.
Oh, shucks. Thanks, Dawn. You can come back anytime. Wham, why were you wearing a mask?
Very similar reasons. Masks protect you, but they actually have a bigger protection for other people. And I think it's important that when we have a public health emergency, like COVID, I mean, we're still talking about 50 people dying in a month or 600 a year. These are preventable. And if there's a small, easy thing I can do, which is put on a mask to help prevent the spread of the virus, that is something that I will do day in, day out. I don't like wearing masks, right? But it's a simple thing to do in public. I came in, you're wearing a mask, I put on a mask. I get on the subway, I put on a mask. I think it protects me, but it's also my duty to others.
This is not about mask shaming here, just so you know, but you were not wearing one. How come?
No, I wear masks in certain situations, but certainly not all situations. We know what masks do. We also know what they don't do. And of course, they can reduce an individual's risk of getting an infection, and that's important for a variety of reasons. We also know that it can protect other people if someone is infected and they're pre-symptomatic or even symptomatic and able to transmit this infection. I work in an acute care hospital. I put on a mask frequently in hospital settings, not just to protect myself, but of course to protect those around me. But I don't wear a mask all day, every day, in every interaction. I know what the data is. I know what the strengths and weaknesses of the data are for risk of infection, risk of chronic complications of infections, risk of transmission. And I think at the end of the day, I think what our duty is really to enable people to make smart decisions for themselves. And some people will choose to wear a mask. Some people will choose not to wear a mask. Some people will choose to wear a mask in various situations. But I think if we enable people to make good decisions for themselves based on their own risks, and as you pointed out, you know, the risks might not just be to that individual, but to their household and family members, I think we're doing something right.
Let me pick up on that, because you had the mask on when you came in. You are obviously not wearing it right now. I say that for people listening on podcast who can't see. Are you taking an inordinate risk by taking the mask off right now? We are sitting 2 feet away from each other. What do you think?
Well, I think, you know, we're in a big airy room. There's not very many of us in this room, so I'm not really worried. On the subway, I will be masked because that's a really different situation. So I think it is about risk. I mean, we all have to make decisions about how much socializing we're comfortable with mask on, mask off. You know, if you think of having a risk sort of budget for the day and the people you want to protect, I want to keep myself as protected as possible so I don't infect the people I care about, so I can spend more time with them unmasked, especially the vulnerable people in my life. So it's a risk assessment. Some people wouldn't be comfortable with this level of interaction, and I would encourage them to keep their mask on. I'm comfortable with this level.
Got it.
So that's my decision.
I mean, very similarly, I thought about it and thought, should I have a mask on in this conversation about COVID to make the point about the need for masking? But as you say, you have to balance the risk, but also can anybody understand you?
Yes.
But it's interesting when you do things like the Emmys, the Oscars, those big occasions, they all have COVID protocols. And when they shut down their COVID protocols for the Olympics in summer, they started having problems. So it's interesting. People are doing risk assessments and coming up with risks. You know, if you can't be shut down for 6 weeks because that will shut down a $500 million film, you know,
that's pretty serious.
People decide they're going to take a different risk assessment. Yeah.
Can I add one thing
Please.
to this? You know, obviously, no shame whatsoever for whatever people choose to do, and appreciating that everyone has different risk thresholds, risk perceptions, risk calculus. That's important, and appreciating that different people are going to do different things. Fine. Part of that calculus is we have some tools to help reduce the risk of infection. They're not perfect, but they're good, right? Masks, we know improving the quality of air in indoor environments is helpful. Is it perfect? Of course not. We know vaccines are helpful, but of course they're not perfect. But also factored into these equations are, this is never going away, okay? This is for forever, and I think that needs to be acknowledged, right? And of course we should take tools to help reduce the risk of infection, but this isn't something that's going to be over in the next year or the next 2 years.
Let me pick up on that. Do you think we, and when I say we, I mean not just the public, but governments, everybody responsible here, not you, but others, have become somewhat complacent about COVID now because we are not, we haven't shut down schools, we're not shutting down cinemas, malls and all that. We're kind of sort of back to normal otherwise.
I think complacency is a huge problem. I think one of the things that I wish we'd done differently during the pandemic is we reported so much about deaths and hospitalizations. I work a lot with older adults, and for older adults, sometimes dying is not the scariest thing. It's losing independence and the ability to live a good life. When I see those hospitalization stats, every number there to me is a family who's going to struggle to help their loved one get back to the level they were. When you're middle-aged and older and you're in the hospital with a serious infection, COVID or any other infection, the chance of going back to the life you once had is small, and we don't have the resources to do that. It's estimated that only 2% of Ontarians get rehabilitation care, which is evidence-based practice for recovering from a serious hospitalization. Our family practices are completely overwhelmed because one of the things that happens post-hospitalization is what's called increased medical complexity. You might have a heart attack next. You might need some help getting mobile again. So the complacency here upsets me because it's straining so many of the other systems, and we're not putting two and two together and attributing the stress in our family practices, the stress in our hospitalization, our healthcare worker burnout, to the fact that we have a lot of hospitalizations still for COVID because there's a lot of COVID going around.
Who do you blame for the complacency?
I think I will put some blame on government policies. It's hard for people to know how serious it is. And we discussed earlier how hard it is to get a vaccine. As I always say as an immunologist, actually any COVID vaccine provides some protection. So when somebody's starting chemotherapy, maybe they're going to the hospital for a major surgery, there are lots of good reasons why you should get vaccinated right now if you have something like that coming up and you can't. And as well, we don't have access to testing. COVID's an unusual infection because we actually have a treatment that helps keep people out of hospital, which is Paxlovid, but it only works in the first day or two that you have COVID. So without the testing, without the public knowledge about that, without any of us being able to say how much COVID is there around, it's difficult for people to make that risk calculation.
Feels, Isaac, like the provincial government, and I'm going to be careful how I say this, but they're reading the room. They're pretty good at public opinion. And public opinion is, we're done with this. So do you blame them for not leading the way?
I want to politely push back on a few items.
Sure.
Think about the levers we have to pull. Okay. Said another way, what are you going to do different? We're well past the era of mandates for vaccines and for masks. Like, that should not even enter the equation. Okay. We know this virus is never going away. We know that we can improve the indoor air quality, and there's a big push to do that, and that's a good thing. We know that many people can choose to wear masks, but again, like I said, we're well past the era of mandates. We know that vaccines do not block infection and transmission nearly to what they did earlier on in the pandemic. They still have some capacity to do that, to a lesser extent and for a shorter duration, but the heavy lifting of the vaccine is to significantly reduce the risk of severe manifestations like hospitalization and death. We know that the therapeutics, Paxlovid, based on the most recent data, probably, keyword probably, helps those only at greatest risk for severe infection and doesn't really have much utility in a vaccinated or infected and recovered population that's younger with fewer risk factors. So, this virus is here, and this virus is going to continue to circulate. And we, of course, can take steps to protect ourselves and protect those around us. I think we have to be realistic about what tools we have and the utility of those tools, which is comme ci, comme ça. And, to one other point that's semi-related, thinking that an infectious disease specialist, an immunologist, an ethics expert are going to navigate this, yeah, we're helpful, but like we really need behavioral scientists. And the integration of behavioral scientists into communication, epidemic management, pandemic management is extremely important. Because to your point, how do you read the room? How do you reflect doing the best you can to protect individual and population health with what is the will of the people you're working with? Because that's going to be different in different populations.
Well, let me ask you about what was...
behavioral science, because I'm a psychiatrist. Yeah.
I was actually going to ask you about long-term care homes, because that was ground zero for many people when COVID was at its worst. Have we learned enough? Are we employing what we have learned to ensure that long-term care homes are safer today?
So I'll come to that in just one second, but just want to pick up on something that Isaac said. One of the things we know about COVID at the moment is it's not the same as most infections. It increases the risk of a number of physical illnesses, and there's a risk of long COVID. And the more often you get COVID, the more likely you are to get long COVID. So if this virus isn't going away, then part of the calculation we have to do on risk, and also the calculation we have to do on public policy, is around what happens over a period of time where more and more people have been infected more times, and therefore we have an escalating number of people with long COVID. If you do the math that way, you start thinking that some of the public health measures that are in our arsenal are things that we should be employing more now to prevent the long-term problem. People think COVID's just like having a cold. It's not. And that is our public policy problem at the moment, is the calculation around acute infectious disease is one thing, but the calculation around what you do about a much bigger long-term risk is another thing, and that's where the behavioral science and the psychology comes in, because as you said, people are done with this. They want to forget. They want to believe that they've woken up from a nightmare and it's not a problem, but it's just not true.
Okay, how about long-term care homes?
I'm going to get... Well, long-term care homes are interesting to me because obviously just before the pandemic we decreased the amount of inspections we were doing. That was one problem. We didn't have good infectious disease protocols in long-term care. That was the other problem that we had. And then we had to make a decision, and we made a decision during COVID that we were going to prioritise hospitals and acute care and ICU beds, and we were not going to prioritise long-term care, which in some ways that was a decision that we made, but we can see from different decisions that were made in BC or decisions that were made in places like Germany, is if you actually put more PPE and protocols and time and policy into long-term care, you decrease the deaths. So we had a disproportionate number of deaths in long-term care homes, partly because we made the decision not to focus on them. So that is something that we should have learned during the pandemic, and something that we haven't learned now, because one of the interesting things from Ontario was your chance of death in a long-term care home, I understand from the figures, were greater if you're in a private long-term care home than if you're in a public long-term care home. So there are things we could learn, prioritise the people at greatest risk, think about inspection and protocols in long-term care homes, but also think about what happens when you have for-profit compared to not-for-profit, and where the values and the value stream happens in those settings. So if you want to expand long-term care and the virus is going to be around forever, do you want to expand it in the for-profit or the not-for-profit sector? How do you want to deal with that? And I don't think we've learned from that as we should.
Let's ask Don whether 4.5 years into this thing, we now have a good enough understanding of what the lasting effects of COVID are on people.
You know, it surprises people to hear that any serious respiratory infection has long-term health consequences. So, for example, being middle-aged or older and being hospitalized for pneumonia, influenza, etc., accelerates risks of dementia, cardiovascular complications, and COVID seems to be worse in many cases than that. So, again, one of the things that we need to think about in this calculus is not just the cost of the acute care, but all the care people need afterwards. Do we have long COVID sorted out? No, we don't. But even if you took that away, even if you took long COVID out of the calculation, you'd still see that people's COPD is being exacerbated by COVID infections like others, and that's the number one cause of hospitalizations in Ontario. You'd see that people are still having cardiovascular events that are attributed to COVID, just like any other respiratory infection. And that increased medical complexity puts a strain on long-term care because sometimes people can't leave their hospital to go to their home. They need respite care, which we do not have enough of in this province. They need long-term care beds. That increased medical complexity is not budgeted for in family practice. So our family practice is based on the health we had 30 years ago, not the age and the demographics of the people we have now. So all of that has to go into the calculus of how we treat COVID and, frankly, other serious respiratory infections as well.
Isaac, down to our last few minutes here, and I wonder if you could help us understand what the consequences of us forgetting what the last 4 years have been like as we look at the future, and in particular, winter.
Okay, you don't need a crystal ball to predict the future. We're going to see a lot of COVID in the late fall and winter. We know that. Everybody knows that. We certainly know what we can do about it. We have vaccines, unfortunately not this minute, but hopefully rolling out soon. We know those are going to be especially important for people at greatest risk for severe infection. And we need to lower barriers to vaccination, really continue to bring vaccine to the people rather than people to the vaccine. We can improve the quality of our indoor air to help reduce the risk of distant transmission. We can enable mask wearing in indoor settings, especially for people who are more vulnerable to this infection. That's pretty straightforward. But a 30,000-foot view is we also have a crystal ball in that this isn't the last pandemic, right? We know we're going to have another pandemic. Of course we're going to have another pandemic. There's a short-ish list of pathogens that would be considered higher probability, but there are significant lessons learned from COVID that should be applied to creating not just a safer Canada, but a safer planet, because no country is an island. And obviously these pathogens do not respect political boundaries. Mm-hmm. And we can be doing a lot more as a planet to help prevent, detect, respond, quell future pandemics. There's a significant number of emerging pathogens out there. And I think my biggest concern is there are many lessons we can learn from COVID, but not a lot of them are actually being applied to create a greater, a safer world.
How big a problem do you see amnesia being right now?
Amnesia, I think obviously people want to forget COVID. Obviously there are governments who, from an economic perspective, who want to get business as usual. And on top of that, there are people who are using COVID and certainly the lockdowns and others as wedge issues. And so there are people who are being mischievous around COVID. So I think there are lots of reasons why people are pushing the amnesia. But I would like to, now we're talking about the brain, just remember that COVID, in the 3 months after COVID, you have a significant increased risk of having a mental health problem. Depression, anxiety, various other things. Cognitive deficits that go with long COVID. So there's this big mental health burden which has come through COVID, and during the lockdowns we had increased rates of intimate partner violence plus substance use, which also have a long-term impact. So one of the things I think when we're thinking about the next pandemic and the things we've learned from this pandemic is don't forget mental health. It's high on the list of important subjects that you need to be thinking about and you need to plan for this pandemic and the next. We are underfunded in Ontario with regards to our mental health services, way underfunded. And we need to boost that if we are going to properly deal with pandemics.
Some good advice from three people who know. Dr. Bowdish, Dr. Bogosh, Dr. McKenzie. Good to have you three with us here at TVO tonight. Many thanks, and yeah, let's go put our masks on after this. Probably a good idea. Thank you all.
Thank you.
Thank you.
Ontario's municipalities are experiencing unprecedented growth and have ambitious housing targets to match. Over the next 10 years, they are planning to spend more than $250 billion in capital investments to keep up with everything. But are the old ways of funding infrastructure construction still working? Let's find out. From Aaron Corey, he's the CEO of the Canada Infrastructure Bank. Lisa Laurent is president of the Canadian Association of Women in Construction. Drew Fagan, professor at the University of Toronto and former Ontario Deputy Minister of Infrastructure. And Craig Dyer is the former Chief Financial Officer for the region of Waterloo. And I know you want to give them a very hearty AMO welcome here in the city of Ottawa. Thank you. Drew, just get us started. I know the people in this room know this, but obviously for the television and broader audience, they may not know. If you need to get infrastructure procured, how do you do it?
Well, it's the simplest way, and everybody, as you say, Steve, in the audience would know this. The simplest way to do it was traditionally through public services. But it's a very, very technically complicated process. It's different than delivering operating services. So you would contract things out, sometimes to the private sector, sometimes you would do it internally, but the risk of actually finishing the project, finishing it on time, on budget, on scope, and the old joke is you could only do 2 out of 3, was on the public purse. Increasingly, and I think we're going to discuss this at some length, the private sector and their capacity is being used to assist the public sector. In some cases, to actually take over the responsibility through things like public-private partnerships, which have worked in some cases, and there's a bit of a reevaluation of that and different methods of doing it. Fundamental issue is not just that we're spending a lot, and we're spending more than we ever have before, $250 million municipalities in the province, probably $1 billion nationally or more at all orders of government. And that should help us to catch up after 30 years of not building adequately. You don't do that overnight, but also doing it more effectively. And we all know examples where that actually hasn't happened, and how we can ensure that we manage the infrastructure better, that we deliver the infrastructure better, and we manage demand as well, not just supply, but demand.
Aaron, as you see what's in the pipeline, and when you understand what the need is, how are those two things matching up right now?
Well, I think the numbers can be overwhelming because the reality is, as Drew said, we've spent decades underinvesting in a lot of our core infrastructure, and that's our social infrastructure. Think of our schools and housing, but certainly the civil infrastructure, what we often call the enabling infrastructure. So the water pipes to get to the new subdivision. You've talked previously about housing. You can't build houses if you don't have streets to get to them, power supply to get to them, clean and efficient power supply, water and wastewater, broadband. So the challenge that we face now is we have a period of underinvestment that we got to catch up on, and then we've got some new realities. We've got a new reality around cleaning the grid and having clean electricity supply. That as we double the demand for electricity, we also have to deal with the remaining stuff that we have to close, coal plants, for instance. So it's a problem of both underinvestment, but also new challenges. And I think what we see is, and Drew hinted at this, but the old ways of paying for stuff just can't work. Like, the math is impossible. Yeah. We can't afford the stuff we need. And sometimes it's important to boil really complex problems down to the simple. We can't afford the stuff we need. And if we don't think of different ways of financing that, and over the long term paying for it, we're going to be talking about $1 trillion deficits and $250 billion gaps forever.
Having said that, Lisa, let me put this to you. I work at a television station that's old-fashioned talking there. I don't actually work, I think I work at a television. In fact, I work at a content creation place now. There we go. My point is, it's in the middle of Toronto, and it's about 100 yards away from what was supposed to be an LRT called the Eglinton Crosstown that was supposed to have opened several years ago at half the price that it will ultimately come in at, and it's still not working.
Yeah.
There is a sense nowadays, I think, that nobody can build anything, never mind two of those three, Drew, any of those three now. Are we wrong to feel that way?
Well, I'm primarily in the road building industry, so one of the difficulties that you have in the GTA or the downtown Toronto is just the ability to get around. And so as soon as you close a lane or a road, you have to revert all this traffic. And we were actually talking earlier today about just the Bloor and Avenue Road and all of the road construction that's going on, all of the LRT that's going on. At the end of the day, it comes down to planning. Why are we doing it all at the same time? They're closing the Gardiner. They're actually going to close 10 kilometers on the way to on the QEW on the way to Niagara. That's already in the plans. So why aren't we planning and working together with the municipalities, with the province for the 401s, and the federal government to say, okay, here's our grand plan of how we need to actually roll out some of this infrastructure, but let's do it smartly and let's work together. Let's talk to the stakeholders. What happens is at the end of the day, they're fast-tracking the Gardiner now. It's going to cost them millions of dollars to fast-track that. No, but I was going to swear, sorry. Nobody thought of that. Like, nobody said, all of the stakeholders downtown Toronto, they're going to be fine with gridlock for months or years upon years. No, I mean, we need to actually sit down, plan, talk about it.
Why don't we plan better?
I'd like to know that answer.
That's the question for me.
Welcome to TVO.
Great. Delighted to be here. So, you know, I'll speak maybe just a little bit about my experience at the region of Waterloo and this whole notion of underinvesting in infrastructure. And I can say that my experience was the absolute opposite. And I'll give two specific examples of, you know, generational investments that were made in my time there over the last 12 years. One was the construction of the Stage 1 LRT project. And the second was a significant investment, hundreds of millions of dollars invested in wastewater treatment capacity. And this is work that was done in order to plan for growth in the future. The challenge we have going forward, in my view, is not so much about financing as it is about funding. And I'll make the distinction between the two. So funding, how do municipalities pay for infrastructure? Property taxes, user rates, development charges, and grants from the federal and provincial governments. The financing piece is just the mechanism of how we go about doing it. Do we use money that we've collected in the past and is sitting in reserves, or are we going to borrow and pay that off at some point, you know, pay that off over 10, 15, 20, 30 years in the future? The challenge we have is a funding challenge. And before we get into you know, new and different approaches to financing, we have to answer the question of who is responsible to pay for it.
And what's the answer?
Well, I don't think it's the property tax and water and wastewater user.
You're preaching to the converted here on that, that's for sure.
Absolutely, and we've been hearing this, to put that burden onto the property tax, which is already, I would say, stretched you know, beyond belief, I think is going to be not sustainable. It's going to significantly affect housing affordability when we think about the total cost of ownership. And that's the conversation that we need to have.
Drew.
Lisa talked about a systems approach, and there's a number of ways to think about that. One is, and the people in this room know this extremely well, 60% of the infrastructure in this country is at the municipal level, but it has 10% of the taxing capacity. And that's very different than any other country in the Western world. You have fewer powers to act independently and then just about any other system in the Western world. That's complicated because the federal system and the 3, even 4 or 5 orders of government regional, indigenous. But that's a fundamental challenge, right? So you have to look to the higher orders of government for funding, and there are very few programs that have been systematized. So many of them are too ad hoc. We were talking about the Community Building Fund. That is what was known as the gas tax. That's $900 million to $1 billion a year for Ontario municipalities. It's now going out 10 years, and you can plan with that. But that only goes so far. So that's a fundamental point. The other point I think that's important is the other thing that we don't do in this country to the point of planning, and why don't we plan better? We don't have the mechanisms to prioritize projects as well as we should. And that is, again, something that other countries do better than we do. If I want to think about what the infrastructure deficit is in this country, or look at the studies, I'll get a number from between $125 billion and $1 trillion. Other countries, New Zealand, Australia, Great Britain, will have commissions that actually define what the deficit means. Does it mean existing infrastructure? Does it mean future infrastructure based on economic and population growth? And what do we need to meet that? And they will have a responsibility and advise political leaders, who ultimately need to make the best decision, with the best evidence of how they should prioritize, because we need to focus on the stuff we really need. We really don't need to focus on the stuff that's secondary, given that $1 trillion, which is what we're going to spend in the next decade, doesn't go as far as it used to.
And I think even to tie that to planning with roads, and I'm saying as we're moving into electric vehicles, and that's the future, this is the direction that we want to go, but our roads are not set up to be able to handle electric vehicles safely. So all of the crash testing is coming out now is saying that the electric vehicles actually, it's a catastrophic failure. They go right through the guide rail. So in Ontario, we would have to upgrade all of that. But then you think about, we fund part of our road building through gas tax. So now you're not going to be paying gas tax because you have electric vehicles. So how are you going to upgrade your roads for the electric vehicles that probably will be mandated at some point in time without actually figuring out where is that funding coming from? So I think that's a really valid point.
Can I just understand that, Lisa? The roads we have now are not set up to handle EVs?
That is correct. The crash testing data that's coming through now at TTI in the United States is the catastrophic failure. So it's the batteries. They're very, very heavy. The makeup of the vehicles. So when they're crash tested, they were crash tested on vehicles, four-wheel drives, two-wheel drives. They actually, even if you're driving like an F-150. Most of the vehicles were cars that were tested.
Aaron, you look like you want in.
Well, I'm just nervous because we came here for solutions, and now Lisa's added a new class of infrastructure to the list of things we have to build. So now I'm thinking that's more to have to fund. So.
I was going to say, retrofitting all the roads to deal with an EV reality, is that part of your $250 billion in cost that you
certainly
anticipate?
Building networks that do allow for electric vehicle charging is, and it's a classic example of the kind of infrastructure. And I just want to go back. Craig talked about the gap difference between financing and funding, and I was getting at the same point. Like, it all starts from what can we afford to pay for, which is the ultimate question is about funding. And we're at and Craig, I think you're right about what the sources of funding are, and obviously we're at AMO, we're talking about municipal infrastructure. But if you just step back for a second and think about the infrastructure our country needs, I would say that there are classes of infrastructure that actually the user pay model is exactly the right one.
Like what?
If we want to extract critical minerals, we should be building roads and clean power supply to regions that open up those areas for development, and the future development that happens in those areas, the mineral companies that come in should pay a toll or a user fee, and over time, if those are profitable businesses, we can get that infrastructure paid for. Electric vehicle charging would be another, right? As we install, the chicken and egg problem is we need to install enough EV chargers across this country, even in Northern Ontario. Lisa and I are both from the north. And I know the challenges of distance and climate, but ultimately we need to build reliable, trustworthy networks of fast EV charging so that people can have the confidence to go buy vehicles, although now they not have the confidence because they're going to be worried about going through guardrails, but so that people can deal with range anxiety. And today, if we're going to do that, it is not a profitable business. And so we got to find ways to fund it initially that might be through the tax base, they might be through public financing. Or they might be, in a case like the CIB, about us taking some risk up front in building those networks.
The infrastructure bank.
The infrastructure bank, excuse me. Thank you.
Lisa, let me come at this from a different angle, and that is, we know what the need is, we know how expensive it's going to be. do we even have enough people to build all this stuff if we wanted to do it all?
No, and I think that's the big thing that's out there now. By 2033, they're anticipating there'll be a shortage of about 89,000 construction workers, and that's just due to attrition.
Is that Canada-wide?
Yep.
Okay.
Yeah. And so, and obviously now I'm the president of the Canadian Association of Women in Construction, and women represent 50% of our population and 5% in the skilled trades. And then I'm now listening to some ads for Alberta, and they're enticing, saying, hey, if you want lower cost of housing, we'll give you a moving allowance. Move to Alberta. We have all of these incentives for you. So now we're going to start to see people actually leaving Ontario to move to some of these provinces that have lower cost of housing, similar wages. So we need to work together. I strongly believe this. We need to work together. KWIC has a partnership right now with Mark's Commercial to do some advocacy with the government and the unions and, again, industry associations, so we can look at how do we attract people to our industry? How do we change the narrative? They actually have skilled trades as part of our Ontario curriculum in the education, and they didn't give teachers any tools on how to actually roll that out. So if we work together, which is exactly what you're saying, is let's bring in those experts that can actually lend their advice, their guidance, probably to some degree some funding. We can figure that out. Maybe we can allocate some of the labor training dollars to have an association or a task force that goes together to identify how do we actually get workers in. The Indigenous population is one of the fastest growing ones. What are we doing to attract Indigenous people or workers to our industries? And there's just, I think there's so many opportunities, but we get caught up, I think, in policy, and I agree with the 4 years. You just start a program and then you have to sell it to either the new people that are coming in. It would be nice, if, especially at the municipal level, if we could actually work together.
Let me follow up on one thing you said with Drew. When you were a deputy minister and you're meeting around that big table with your fellow deputies, do you ever recall having any conversations with anybody about how to get the number of female workers as part of this up from 5% to something a little more resembling the population split?
I actually did at the end of my time in government, or just after I left government, I did a study for the previous government, and I must say the Conservative government has really taken this on as an issue. They are making progress on this in a couple areas that I'll talk about. So yes, but towards the end, and was it a fundamental priority when I was deputy and sort of 10 years ago? No, I don't think there was the recognition that the skilled trades were going to be such a demographic challenge. In the same way that so the issue of demography generally has kind of exploded in the last couple of years, but there's a huge focus on it now because we know that we need the workers, and part of that is to bring in non-traditional parts of the population. One thing that I was really struck by when I was looking at this was, if I could put it this way, the journey of a student after high school trying to get into the skilled trades was much more difficult, much more complicated than somebody that went to university or college. And in many cases, they were coming from families, not always, but stereotypically, in which their ability to navigate that journey might have been not as strong as in others, right? So the percentage of students that quit before finishing and getting their trade was higher than it was in universities and colleges. That's been simplified to a certain extent. Can I just go back to a topic, one linear infrastructure project that we haven't mentioned that will be, if it goes ahead, the biggest of all. And talking about Aaron speaking about, what's increasingly known as progressive contracting, which is really that the two sides, public and private, work together throughout the project as opposed to handing off risk. You write a contract, then you fight later on if it doesn't go well. High-speed rail or high-frequency rail from Toronto to Quebec City, which will be multiples bigger than any other infrastructure project that the country's done in this modern age. A decision by the federal government is supposed to be taken in the fall. I've been tangentially involved. But so the process that they've set out, and the CIB's been an advisor on it as well, is a good example of that kind of potential contracting in which you're going to work out not just the route, everything together. And I think that will be a more sophisticated way about thinking about this and work through the decade as a partnership, or that's the goal.
Let me do a fast follow-up with you on that, because I think I read my first study on a possible Windsor to Quebec City rail corridor 45 years ago.
Yep.
We talk a lot about this. I'm not kidding you, 45 years ago.
Me
We
too.
talk a lot about this, and everybody thinks it's the shiny bauble in the window, and it's never got to first base.
So I started off as a skeptic, and what's changed is, and I was in the provincial government when David Collinette did a big study, you'll remember, about 10 years ago, and he was a big high-speed rail fan going back to when we were reading about it 45 years ago, right? The population density of Toronto to Quebec City, or Windsor to Quebec City, and particularly the Toronto to Ottawa to Montreal corridor, is typical, equal, or higher than most of the corridors in Europe that have high-speed rail now, right? So the biggest challenge with this project in some ways is that very perception. And it's not an unreal one. That's where I started. And then I started looking at it more deeply. And the capacity to actually invigorate economic development, you start thinking about Peterborough in this example, or other places, Kingston potentially, everybody's proposing different lines, as something closer than, I don't want to say bedroom communities to Toronto, but bringing them together for economic development. It's something that's quite dynamic. Whether it happens is something else, but this has gone further than any other, and it's that form of contract that I think might help.
So let's circle back then to the original question we had, which is, you told us we need $250 billion going out the door. So, you want to start us off here, Craig? Where's that money going to come from?
Well, you know, one of the things we haven't spoken about today is development charges. And there were comments made on housing about the future of development charges and what this is going to look like in this province. They've been made out to be the culprit in some ways here, which, you know, I don't quite believe that to be true. But development charges are under attack, it feels, by many, by developers, by maybe by the province, maybe by the federal government as well. You know, I think, you know, talking to municipal CFOs, finding this balance between attempting for growth to pay for growth. People often say, well, the Development Charges Act allows growth to pay for growth. It doesn't. It never has, and it won't based on how it's written right now. But it certainly makes a sizable contribution to the funding of significant infrastructure investments that municipalities are putting in place. If the desire is to not have a development charge, then it goes back to the original question that I posed, which is, okay, well, who pays then?
Yep.
Right? And again, like that comes back to to me, that comes back to the, you know, the basic conversation that we have to have before going into individual solutions. And so, again, so in the absence of development charges, what happens? Does the price of new housing go down? I would say it won't.
Probably not. No.
Probably not.
Yeah.
And so, but if we've removed that funding source, what gets put in its place? Keeping in mind, development charges were put in place originally back in 1997, you know, shortly after the province got out of putting grants into water and wastewater infrastructure in particular, right? So it created a revenue source for municipalities, not a revenue source, let's say a recovery mechanism to allow municipalities to recover the cost of growth-related capital. And if that's not desired in the future, or if something different is desired, what does that look like? I'm not sure I have the answer.
Lisa's got the answer.
But I'm not sure that development charges are the culprit that people are making them out to be.
Fair enough. Lisa's got, all right. I'm sure this audience will have rapt attention at the response that you're going to give now. I'll just lay it right out there. Where are we going to get all the money?
Oh, I just think cut a little bit off of the infrastructure spending and allow it to be given to the municipalities for your development. You need to build roads to get there. You need emergency services, and that's all part of the municipal funding. So just allocate the money accordingly to allow us to be able to build new homes. Maybe you build few less homes, but you have roads that get there, you have, emergency services and schools, and you build communities. Because at the end of the day, I agree with Aaron. It's about what is it building the community. Look at the communities that have been very, very successful. What have they done? They've thought it out from beginning to end, and so not all the funding goes into one pot. It funds everybody. And maybe everybody gets just a little bit of it, and we all win instead of one item winning.
Drew, you got some thoughts on this?
So, absolutely. In terms of funding, the senior orders of government.
They don't like that here, incidentally.
Yeah.
They like different orders of
different
government.
Orders of government. I did use orders as opposed to levels. Absolutely. So maintaining funding or in continuing to increase it given demand. There are things you can do that are more than on the margin, revenue generation, right? With the impact of that to reduce demand or manage demand. Things like in big cities land value capture, which is a fancy word for when the value of the land goes up, those who benefit from that land, developers primarily, pay more into the coffers. So, for example, the Elizabeth line in London was paid by developers to a limited but sizable extent on the expectation that the value of their developments, their housing developments along the line were going to go up significantly.
Anybody doing that here?
Very little. Very little. There are a couple of examples, you know of them, but we could do more, particularly in Toronto. Better planning with regard to housing. The model in Toronto was tall and sprawl. So and we're starting to think about that. And finally, the issue of asking ourselves why we're such an expensive builder. When we manage to build transit, we're actually expensive. Why are we so expensive? What can we do with the construction firms? Many of them are world-beating, but some of them still are mom-and-pop shops, and the statistics show that their productivity, actually across the board in construction, is not growing at the same extent as other sectors. Why is that? So a bunch of questions that we should be asking, not just about the funding, but getting the best value for the funding, including managing cost.
You got a thought about where we're going to find all this money that we need?
Well, I think Craig is so right. It's actually, there's only really one place to find it. Like you have to pay for stuff. Who's paying for it? Yeah. Our citizens. There's lots of channels how they can do that. Development charges, property taxes, through your income tax and the central revenue fund of the federal government, which then get distributed back out. They're all pathways back to the same person who's paying. So I think life is full of choices, and what we say at the CIB is we're very agnostic to the choice of revenue sources. So if a municipality wanted to do a wastewater system that enabled housing development, it was going to open up 10,000 new homes, and they came to us, we would say, great, we would make you a loan. Let's talk about where the revenue could come from. It's any mix for us of development charges, property tax uplift, people call that tax increment financing sometimes, the user rates of the new customers that'll be on the system. And if you add all of those up together, then Craig's exactly right. Growth doesn't pay for growth, but it might pay for 80% of growth, or it might pay for some, and then you've got a gap that's remaining. That's going to have to come from, let's call it the general tax base. At the end of the day, what I think is municipalities, I have no opinion about which tool is better. I'm not an elected official, and I'm not the controller of purses. I think each municipality should have a different mix of those things. It's going to depend on how much growth is happening in their community, what the development tax regime is, what water user rates have historically been, and what capacity they have to pay. So to me, the real issue is how do you give each municipality all of the tools at their disposal, from long-term stable federal funding through the building fund, all the way to their local tools, development charges, property taxes, and have them put together ways to pay for the infrastructure. What I will do then is be able to lend the money against that future revenue in a way that shares risk and allows them to be bold. So allows them to put in place the water for the next 30 years so that development can happen. The other problem, Drew talked about how expensive it is to build. One of the reasons is because we build piecemeal, because we build for how much money we have in the budget for this year and then next year, and we do a little bit at a time. That's everyone knows a more expensive way to do it. One of the reasons a tool like an infrastructure bank, and Canada's not unique in this, is happening all over the world, we do this is to help make these long-term decisions and manage for the fact that none of us really know with any great certainty, will it take 8 years for those 10,000 homes to get built, 6 years, 12 years? 2 years, let's hope. So what's the pace of that development? And if we're going to say that that's what's going to pay for a significant portion of the infrastructure, you need to be able to manage that uncertainty, and most municipalities can't. So that's what a tool like us can do. We can help make long-term decisions and smooth whatever the funding tools are that a municipality chooses to use from their set of available tools.
Craig, last word to you.
The one thing I would add to Aaron's comments is the discussion about how to pay for the infrastructure that's needed for 1.5 million homes to be built in this province is, we can't look at that in isolation. Right? So so as we're considering what the answer is to that question, there needs to be, what would I call it, a resetting, a recalibration, if you will, of the responsibility and accountability for for public services in the province, and then the funding framework that goes along with it. Because if you think you've solved the housing enabling infrastructure problem, we're just going to go right back to, well, what about the homelessness and affordable housing problem? And what about, whatever other problems are out there? So it needs to be, I believe, a broader conversation about how municipalities are funded and what services they're responsible for.
Great. I want everybody in this room to help me thank these 4 guests for coming here to the Association of Municipalities of Ontario Conference and teaching us so much more about this subject that we know. Thank you very much, you 4. Much appreciated. And that is the agenda for Tuesday, October 1st, 2024. Happy 100th birthday, incidentally, to Jimmy Carter. We encourage you to read my column on the former American president, whom I had the honor of meeting several times in his native Plains, Georgia. You can find it at TVO.org. Tomorrow on the program, a look at Ontario's aging water infrastructure, what's being done to modernize it, and who's going to pay for it. I'm Steve Paikin. Thanks for watching TVO, for joining us online at TVO.org, and we'll see you again tomorrow.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.